Hello. For today, I'd like to talk about a PSA. PSA is a test run in men, particularly over the age of 50. PSA stands for prostate-specific antigen. Probably most men over 50 have heard of it. Now, the PSA is a compound that is made in the prostate. Now, what is the significance of PSA? Well, it has a normal value of about 4 or less. If it goes above 4, it can be a sign of inflammation or, more worrisome, an early prostate cancer. The higher the number, the more worried we should get. So like I said, it should be around 4. It's not uncommon for it to naturally go up as a man gets older. Particularly over 70, it can go to 5, 6, 6.5. So recommended screening is usually starting around age 50 to 70. After that, there are guidelines that say don't even check anymore because it's going to go up. However, new guidelines say if you have a healthy 70-year-old, continue to check because we want to know if it goes into cancer. So where do we draw the line between elevation that we follow versus elevation that requires something more aggressive, like an MRI of the prostate looking for cancer or a prostate biopsy? So it's the rate of increase of the PSA. Like I said, it should be around 4. Now, in the past, we used a tripling. If it goes from, let's say, 2 to 6 or 6 to 18, that's a 3-fold increase, and that would signal more cellular activity that should probably be further evaluated. It is not uncommon to have a man over 70 who has a PSA of 5 or 6, and it stays there, and we usually just follow it to make sure it doesn't go up. Now, can anything else make the PSA go up falsely, or that it's not prostate cancer? Yes, prostate inflammation, pressure, infection. I have some patients that ride bicycles for security all day, and that pressure in the rectum area can cause the PSA to go up. So it's not always cancer, but it should be followed very closely. It is a hot topic in the world right now in the United States about when to check and when to stop checking. But in general, we check serially or routinely, especially if there's a significant increase in the PSA. 4 goes to 14, goes to 40, goes to 400. That needs to be evaluated. Good news is, if it is an early cancer, it's extremely treatable. You know, there's some very famous people that died of prostate cancer. Bill Bixby, who was the Hulk, David Bowie, even most recently Eddie Money. But it is very treatable these days, especially if it's caught early. So men that are watching, make sure you have your PCP, check the PSA at least once a year. I hope that helps clarify. Thank you.